right. Hello everyone. Uh, we'll just we'll just get started because I heard we're tight on schedule. My name is Miguel Barrios. If you haven't met me, I'm a PGY4. And today I'm just doing one of like our disaster pre-hospital topics. And I'm going to talk about heat waves today. So today we're first really talk about like what is a natural disaster, what is a heat wave, what are the impacts, the effects that it can have, what can we do to mitigate these efforts, and different types of heat emergencies and how to manage it. So a natural disaster is kind of just any major consequence as a result of a natural hazard. So this actually is dependent on what is the vulnerability of a specific area. So something that happens in one area may not be considered a disaster for another area if they're just not, if they are properly prepared for it. But if a natural disaster is basically needs to have significant like social and economic consequences to the community. There's a few different types of natural disasters. There's first category is called like geophysical. This is basically earthquakes, tsunamis. Then there is meteorological, which can be like tropical storms, tornadoes, blizzards, sandstorms. Then climatological, which is more like freezing temperatures, heat waves, droughts, wildfires. And the last one is hydrological, which is just like flooding. It could be flash floods, river flooding, or storm surge. Um, Not all natural disasters actually fit directly into one category, and they can actually meet multiple. So, like, let's say if like a hurricane hits like a coastal community, it would be both a meteorological disaster and potentially hydrological if there is a storm surge that comes along with it. Just to go over a little bit of data, the just to this chart is just showing the different number of like victims and casualties from natural disasters. So this is looking at worldwide from 1990 to 2013. And the most number of mortalities actually caused by geophysical natural disasters, which is the like tsunamis and earthquakes. But the ones that actually affect the most people with lower mortality rates are hydrological disasters. But today, I just want to talk about one of the specific climatological ones, which is heat waves, which we actually see in New York City, which is why I wanted to speak about it. So a heat wave is just a prolonged period of unusually high temperatures. It's usually like about a minimum of 2 days, and it has to be higher temperatures than what's like the average temperature for that area. And like I mentioned before, it has to be like specific to what that community is like accustomed to. So let's say 100 degrees in Arizona, in the desert will not really be a disaster, but here having it for a few days or up to a week can actually have devastating consequences. Just to go over like little times that where heat waves have actually caused a lot of victims. In Chicago, 1995, there was a heat wave that actually killed about 700 people. And then in Europe, more recently in 2022, there was actually almost 62,000 people that died from a heat wave. And closer to home, New York City actually had to activate a heat emergency plan this summer in July due to high temperatures. There's no current data yet of like how many victims might have actually succumbed to this heat wave that we just had. But the CDC actually tracks the temperature across the country. The areas highlighted in like red and like deep red are like the temperature in each like county across the country. And you can see that on this day, it was actually August 1st, 2024, most of the country was actually having temperatures greater than 90 degrees. The the country is actually separated into different zones or regions, and the CDC actually tracks the number of heat-related ED visits per day. So you can see on August 1st, the New York region actually had 184 ED visits on August 1st. But on that day, there was 3 zones that had like exclamation points, and that's when an area has a much higher number of heat-related emergencies than their average. And so they try to track this to figure out where um, might be having like more heat-related emergencies. This is another graphic from the CDC that just compares year over year from May to July of 2023 compared to 2024. From 2023 to 2024, there was in most areas across the country, there was actually an increase in number of heat-related ED visits. Specifically, Region 2, which is New York, it was about double. So whenever there's well, the CDC actually since they've been tracking this, they're also trying to prevent having any victims or deaths related to heat. And so they've set up this like 4-tiered plan to try to help reduce the number of victims. The first one is just tracking the heat forecasts just to see when the temperatures will be high, when the heat indexes will be and how high they will be and for how long they will be elevated for. They also want to like increase awareness of like who might be at increased risks, which we'll talk about a little bit later. And then there's also they want each community to create cooling stations, so people that might not have access to air conditioning or they might be homeless will be able to go somewhere to be able to cool off. And then finally, it's home energy assistance programs, which I'll go into a little bit more later. They also have this like graphic that they actually released to the public, then trying to increase awareness to extreme heats, and this they call it like, beat the heat. And so what they've been trying to tell the people is like trying to let them know who needs to be worried. So this is going to be specifically like children, especially like infants less than 1 year old, any elderly patients, anyone with disabilities, especially with multiple comorbidities, and anyone that sort of works outside, especially with manual labor. So this can be construction workers, farmers, landscapers. The areas that actually can be that are more vulnerable are just homes or apartments without air conditioning, any sort of like work site that would be outdoors, and then as well as cars. The interesting thing about cars is that if you leave a car outside, let's say it's 80 degrees, once it's outside for 20 minutes, the inside temperature is going to be 109 degrees Fahrenheit, but after an hour, it can go up to 123. But that's only if the temperature outside is 80 degrees. And as in one of the previous graphics, you can see the temperatures were like 90 plus, in some areas 100 plus. So you can imagine how hot the inside of a car can actually get. So New York City actually used the like 4-tier plan to try to create a method of dealing with heat in New York City. So they have created an advanced warning system. So this is going to, they work alongside the National Weather Service just to be track whenever the temperatures will be elevated so that they can actually make announcement for any sort of like heat emergencies, awareness for people to know when they shouldn't be outside, and then like activates like cooling centers throughout the city. Also, the fire department has like a cool program where with prolonged elevated heat indexes, they actually can use their fire hydrants. They put special caps on it so that people can actually like cool off with some water. And then the park system in New York City has something called cool streets, which I'll go into a little bit later. So New York City has actually created a very extensive like network of cooling centers. And they actually on this website, you can actually see where they're located throughout the city. I just took a screenshot of how many there are across. So it's basically almost in every single community. Uh, I put the zip code of the hospital, and there's a couple around the hospital. A lot of these sites are actually going to be like churches and libraries. So these are sites that can actually easily be opened at any point because they're probably already going to be open. So they're already going to have the systems of having like water fountains, air conditioning. So it's not going to take a big effort out of the city to open these as cooling centers. Uh, the park system actually also has this website to increase awareness of where people might be able to get water across the city and who might be more vulnerable. So the areas shaded in like red and orange are the areas that they say have really high heat vulnerability. The and you see like most of um this this area in Brooklyn is in like the second highest like air like vulnerable area. Um so the two things that they've done to try to increase like um access to um help people escape from the heat is one is like increase awareness about water. So all the areas in blue are water fountains that actually are across the city so people can actually get access to water. And then all the areas in green, the lines in green are streets that have a lot of tree cover. So they are able to tell people that these streets are actually much cooler than probably the next street over. So if you're going to be outside, you can actually like either hang out in those areas or walk through those areas instead. The park system also has this program where if your area doesn't have any like trees, you can actually request a tree to be planted on your street. And you can actually even pick the type of tree if you want. Um, so if you're in one of the areas that doesn't have tree cover, which will be the ones without the green lines, you can try to get some trees in your area, which will also help with some pollution. And then this is also a program that we can actually let some of our patients know about is the Home Energy Assistance Program. So they have like strict income requirements, but you can tell people to apply to this and they will basically determine people with financial need that need air conditioning, and they'll actually purchase air conditioning units and provide it to different apartments and homes. If the reason why they can't cool their home is due to like the cost of electric bills, then they actually will also assist with paying their electric bills. Um, so I mentioned it a little bit earlier before about like risk factors or who is can become victim to increased temperatures. Again, this is going to be our like elderly patients or children, but also people that live in like urban dwellings, anyone with any drug abuse, alcoholism, and as well as poor socioeconomic conditions. Um, there is like a different types of like heat emergencies from like most benign to extremely dangerous that needs to be treated right away. Um, so the most benign is sort of just like a heat rash. This is just going to be like a pruritic erythematous, like dermatitis. The sweat glands become a little inflamed. They turn into like vesicles and might burst. Um, and this is just a little picture of what it might look like. Then there's heat cramps. Heat is basically when like large muscle groups starts spasming and can just be extremely painful. Most common area that this can happen is actually in the calves, but can also happen in the thighs or the shoulders. And then the last two are heat exhaustion and heat stroke are actually more on the emergency side, where we need to treat it urgently to help our patients. Specifically, heat stroke, if it's not treated in a timely manner, there's 100% mortality. But if you treat it really quickly, can go down to as low as 30%. So some symptoms of like heat exhaustion is like tachycardia, they may be vomiting, diffuse sweating, maybe they're going to be a little hypotensive. But the important distinguishing factor between heat exhaustion and heat stroke is actually having a normal mental status. So the heat stroke actually, they are going to have like hypothermia. Their temperature is going to be at least 103, but can even go up to as high as like 110. They'll have like neurological dysfunction, and they may stop sweating. Uh, this is another graphic that's just to be able to just compare the two. The main thing is really just like the confusion for heat stroke. They might stop sweating at this point and the increased temperature. So what do you do when you have a patient with heat stroke? First is like recognize it, right? Like, so uh, this might for a person that might be found unresponsive on like sidewalk or side of the street. And once EMS arrives, the first thing they should do is ABCs. Just make sure that they're protecting their airway, that they're breathing, they have good pulses. Um, but the next step is, which is going to help prevent them from getting worse, is just remove them from the heat. So if it's related to the sun or they're outdoors, then it's vital to bring them inside into air conditioning and out of the sun. And then try to get a temperature as soon as possible to actually see if they're hyperthermic. Um, it's good to also just remember like differential of what can cause severe hyperthermia. Uh, Other different causes are like neuroleptic malignant syndrome, malignant hyperthermia, serotonin syndrome, hyperthyroidism, and sepsis. Uh, the way you be able to like rule these out is kind of with like history taking an exam, just finding out whether they're on antidepressants or antipsychotics, whether they've had a recent procedure that required sedation, um, or really any sort of like infectious like symptoms. So once this patient arrives to the ED, the most important thing is to cool this patient down right away, right? So the goal is to actually decrease the body temperature by 1 degree Fahrenheit every 3 minutes or 1 degree Celsius every 5 minutes. So how do you do this? Right. So if the patient has like just a mild hyperthermia, maybe they're just like around 103, 104, you can actually maybe try some ice packs. You can put ice packs around like the neck, the axilla, the groin. But these ice packs, as if you've used them before, they only really last about like 10 minutes and then the cooling effect wears off. So this is only really like a temporizing measure and might not be the most effective. Another thing is cooling blankets. Actually, don't think I've seen one, so I don't know if we have one. We do. Okay, so basically just hook a cooling blanket up to a machine, and it just circulates like cool water to try to keep the patient cool and lower their temperature. And then on the more extreme side is body vents. So if you have a patient that is like altered, their temperature is 109 and you need to bring their temperature down right away, get a body bag, put the patient in it, fill it up with ice as well as water, um, and this should help cool their temperature down. If you have to resort to this, you cannot leave their bedside because if they're confused, they might slip into the water and there's always risk of drowning. So you have to be at the bedside. Yep. Oh, thank you. So thank you. So all of these are external sources of cooling. So you can actually also do internal. So the most common one that we have or easiest to access is actually like IV fluids. Ideally it'd be chilled, but even if it's room temperature, it'll be around like 70, 75 degrees Fahrenheit. So it actually might be, it'll still help cooling the patient down. And then in terms of more refractory or severe cases of hyperthermia, you can do things like bladder irrigation, put a three-way Foley, and just irrigate cool water to help decrease their temperature. You can also do a cooling catheter, which basically functions like a central line. You put it in the femoral vein and hook it up to. And we have in our hospital we have the Zoll machine, and that can also help cool them down. In also more extreme cases, especially if you have surgery around, there's been studies that you can even do like chest tubes and irrigate the chest cavity or perineal or not perineal, peritoneum irrigation or lavage. And but if like you try all of that and you still have hyperthermia, the last resort is ECMO. So you can use this to help stabilize your patient and try to cool them. So our ultimate goal with cooling our patients actually not to get them to normal thermia is actually to get them to 102 degrees Fahrenheit. Um, then I want try to do continuous temperature monitoring. So this would be probably with a rectal probe. Um, and then since these patients have probably been sweating for a prolonged period of time, they can actually also have a lot of electrolyte derangements. And so just replete any electrolytes that they might have lost from all their sweating. And then ultimately, it's just supportive care. So just to summarize, just heat waves have become more frequent across the country or across the world. And there has been an increasing number of ED visits. They often affect more vulnerable populations, and heat strokes have really high mortality if untreated. And so the goal is to cool them as rapidly as possible.